Hey everyone, welcome. If you're tuning into this explainer, chances are you, or maybe someone you're taking care of, just picked up a brand new prescription. We're looking at Moxifloxacin 0.5% eye drops today. Now, let's be honest. We all know those tightly folded patient information leaflets look like a tiny, intimidating novel written in a totally foreign language, right? But don't worry, my mission today is to completely demystify all that dense text for you. We are going to break down exactly what this medicine actually is, how to use it safely, and what to expect. We're using the official source material so you can walk away feeling 100% confident and informed about your treatment. So, got a new prescription for an eye infection? Yeah, it's absolutely never fun dealing with irritated, uncomfortable eyes, and the very last thing you need is confusion about your actual treatment adding to that stress. So, let's clear things up. Think of me as your friendly virtual pharmacist today. We're going to walk through this leaflet together, step by step, making sure you know exactly how to handle your treatment safely and effectively. All right, here is our roadmap for today. We'll cover 1. What is moxifloxacin? 2. Important precautions. 3. Prepping your bottle. 4. Step-by-step application. 5. Understanding side effects. And finally, 6. Storage and disposal. Let's get right into it. Okay, let's dive into this. Section 1. What is moxifloxacin? First stop on our journey, just understanding the medication itself. What exactly is sloshing around in this little bottle? Well, the active ingredient here is moxifloxacin. The leaflet officially describes this as an ophthalmological anti-infective. Let's translate that medical jargon into plain English, shall we? Ophthalmological literally just means it relates to the eye, and an anti-infective is, you guessed it, a medicine that fights an infection. Specifically, this is an antibiotic used to treat bacterial conjunctivitis, which is just the fancy medical term for a bacterial eye infection. It's designed to go straight to the source and completely wipe out the bacteria, causing all your uncomfortable symptoms. And when it comes to how much you actually use, your magic number is 3. The recommended dose, whether for adults, older patients, or kids, is exactly 1 drop in the affected eye 3 times a day. Think of it as just a really steady routine: morning, afternoon, and night. Consistency is absolutely key here. You want to keep a steady amount of the medicine fighting that infection throughout the whole day. Oh, and a quick reminder, you should only be putting drops in both eyes if your doctor specifically told you to do so. Section 2. Important precautions before use. Now, before you even crack open that bottle, here's your first major pre-flight check. For those of you who wear contacts, it is a strict, non-negotiable no while you have this infection. You literally need to stop wearing your lenses immediately and switch over to your glasses. The source material is crystal clear on this. Do not start wearing your contacts again until the signs and symptoms of your infection have completely cleared up and you've totally stopped using the medicine. This is super important because it prevents trapping bacteria right against your eye, allowing the drops to actually do their job. Let's look at a few other vital warnings. Naturally, do not use this if you already know you're allergic to moxifloxacin or other quinolones. But here is something you might not expect at all. There's a specific warning about a risk of tendon swelling or pain, what we call tendinitis. This is particularly crucial to watch out for if you're an older patient or if you're taking corticosteroids at the same time. If you start feeling any tendon pain, you need to stop the drops and talk to your doctor right away. Also, just a quick everyday safety tip. These drops can temporarily blur your vision right after you put them in. It's totally normal. But wait until your vision clears up completely before you try to drive a car or operate any machinery. Section 3. Prepping your new bottle. Okay, so you've got the box in your hands. Now let's do your first-time setup. Look closely at the bottleneck. And this brilliantly illustrates exactly what you're looking for. You need to verify that the tamper-evident ring between the bottle and the cap is completely unbroken. If that ring is already broken, do not use it. But once you confirm it's secure, you simply tear off that tamper-evident ring to break the seal. Once that little plastic ring is completely out of the way, you open the bottle by firmly turning the cap counterclockwise. Boom, the bottle is open and prepped. But wait, applying eye drops correctly is actually a bit of a specialized technique, which brings us perfectly to our next crucial step. Section 4. Step-by-step application. I'm going to purposefully slow down the pace of it right here because getting the medicine into your eye safely is arguably the single most critical part of this whole process. Step 1, and I literally cannot stress this enough, wash your hands thoroughly. Remember, you are dealing with an active bacterial infection, so hygiene is absolutely paramount. Next, tilt your head back.
As you bring the bottle close to your face, keep this golden rule locked in your mind. Do not touch the dropper tip to your eye, your eyelid, the surrounding skin, or honestly any other surface. If you do, you risk contaminating the drops and potentially making your infection so much worse. Now, gently use one finger to pull your lower eyelid down just slightly. What you are doing here is forming a tiny little pocket between your eyelid and your actual eyeball. That little pocket, that is your target. With your pocket ready, gently press the bottom of the bottle to release exactly 1 drop of medicine. If you miss, hey, don't panic, just wipe it away and try again. Now here is a fascinating and incredibly vital step that so many people completely skip. Immediately after putting the drop in, close your eye and press a finger into the inner corner of your eye, right there by your nose, and hold it for 2 to 3 minutes. Why? Well, this physically blocks your tear duct. It literally stops the medicine from draining out of your eye and getting absorbed into the rest of your body. It keeps the medicine exactly where it's needed most. After you're done, tighten the cap firmly. And hey, if you are treating both eyes, go wash your hands again before starting on the second eye to prevent spreading the infection back and forth.
Section 5. Understanding side effects. Reading side effects on any medication leaflet can feel pretty intimidating, right? But let's organize this logically so you know exactly what to look out for without panicking. So the crucial point is really just understanding the frequency of these effects. The most common side effects, which might affect up to 1 in 10 people, are localized right there in the eye. We're talking things like mild eye pain or irritation. Moving on to uncommon effects, affecting up to 1 in 100 people, you might see dry, itchy, or red eyes, or even experience a general headache or a weird bad taste in your mouth. Rare side effects, hitting up to 1 in 1,000 people, can include things like blurred vision, eye swelling, or feeling a strange lump in your throat. Now, generally, the leaflet advises that you can carry on taking the drops even if you experience mild side effects, as long as they don't become serious. However, there is a very important exception, and I'm going to slow down significantly to make sure you absolutely catch this safety warning. If you experience a severe allergic reaction, you must stop taking the drops immediately and tell your doctor right away. So, what does a severe reaction actually look like? You are looking for sudden swelling of the hands, feet, ankles, face, lips, or throat, which might cause difficulty swallowing or breathing. Other major red flags are sudden rashes, hives, or large fluid-filled blisters or sores. If literally any of that happens, put the bottle down and seek immediate medical help. Section 6. Safe storage and disposal. Okay, we are entering the final phase of our treatment journey. Let's talk about the total lifespan of this medication. This timeline charts your expected path beautifully. You start on day 1, taking your drops 3 times a day. The infection normally starts improving within about 5 days. If you reach day 5 and see absolutely no improvement whatsoever, you need to contact your doctor. But if it is clearing up, don't just stop. You should actually continue to use the drops for a further 2 to 3 days after your symptoms clear, or as long as your doctor specifically told you to, just to make sure the infection is truly 100% beaten. Finally, at week 4, regardless of how much liquid is left, it's time to say goodbye to the bottle.
I want to heavily emphasize that last point. The strict rule is that you must stop using the bottle exactly 4 weeks after you first open it. Do not keep it in your medicine cabinet to use the next time you get an itchy eye. Why? Because over time, the bottle itself can become contaminated with dangerous ambient bacteria, and putting that into an already vulnerable eye is a terrible idea. 4 weeks is the strict cutoff to prevent nasty secondary infections. And when it's time to dispose of it, please don't just chuck it in the household waste or pour it down the sink. Ask your local pharmacist how to dispose of it safely to protect our environment.
And there we have it. We've navigated all that complex medical terminology, we've mastered the unboxing prep, and we've completely perfected the drop technique. Knowledge is incredibly empowering, especially when it comes to taking control of your own health. Follow your routine, keep everything perfectly clean, and you'll be seeing clearly again in no time at all. But, it makes you wonder, if there are this many critical hidden steps to safely using just a simple bottle of eye drops, what other fascinating medical secrets are hiding right now in your bathroom cabinet? Thanks so much for joining me on this explainer. Stay curious and take excellent care of your health.